This is Dr. Jason West with your daily 5 in 5. 5 daily health tips in 5 minutes. Today I'm going to share with you 5 tips about heartburn and indigestion and the secrets to upper GI health. I've had this discussion multiple times a day with patients because if your digestive system doesn't work, you don't work. So let me ask you a question. Did you know that most heartburn comes from too little digestion? What? And most of the time, taking antacids prolongs the problem. So watch this video for the 5 things to do about heartburn, indigestion, and GERD or gastroesophageal reflux disease. And here's the most important points. Number 1, non-plastic foods, chewing foods, speeding up digestion with apple cider vinegar or the right digestive enzyme, the stomach protector, and a magic mineral therapy. Now, almost all my chronic disease patients or chronic ill patients have some type of stomach problem because you are what you eat, or maybe a better way to say it is you are what you absorb. But what you're putting into your system, if it can't get to the right place, you don't feel very good. So a couple things to consider about that. Number 1 is we want to make sure that we're putting the most healthy things possible into your stomach. I was talking to a patient the other day that termed it perfectly. The closer your food to earth, the least amount of steps possible, the healthier you are. If you are picking it right out of the ground or picking it out of your garden or a tree or a farmer's market, it's a lot healthier than if it's processed and goes through a supermarket system, shipped across the country, or is pre-digested, prefabricated, pre-synthetic. I mean, if it's one step away from being plastic, it's not good for your system either. Number 2, so many stomach problems start by not chewing correctly. You know, I have people that literally just inhale food. They chew it once or twice and then down the system. We had a patient that said they solved their chronic health and the indigestion problems by chewing their food more. And I said, well, how many times do you chew your food? And he said, at least 25 times. I looked at him and thought, man, I don't know if I've ever chewed food that much. But I went in and did a whole bunch of research, and there's actually a really good recommendation. If you're having stomach problems, you need to chew your food more and make sure you're getting enough water. And then you could actually get everything to move through and avoid, well, I was going to say cancer, but that's not the right word, but avoiding acidic foods, specifically soda pop and diet soda pop. If you're taking acid, you're putting it in acid into an acidic environment and actually disrupts the normal chain of events that happens in your stomach. Now, number 3, if you're having acid reflux, heartburn, indigestion, one thing that you want to determine which it is, because you have too much acid being generated, or is it the wrong kind of acid? Because if you're putting in your system and it doesn't break down, it'll sit there, it'll ferment, it'll rot and decay. It can't go south, so it goes north, and this is where you get all that heartburn and indigestion. So one of my favorite things to do is to give people a proteolytic enzyme to help break down the food. Now, what that means, it's a natural, non-invasive, really inexpensive hypothesis to test if you're having the wrong type of acid use, but you can use some natural apple cider vinegar. I like Bragg's apple cider vinegar, about a tablespoon and half a glass of water after meals. If it helps your digestive process, 1, either keep doing it, or because it's hard to argue with the results, or you can switch to some type of pill that helps to break the food down. Now, this is what I typically do. I don't like to drink apple cider vinegar, but I don't mind taking digestive enzymes. And the enzymes you want to help to break down food, and you avoid getting the burping, the belching, and the flatulence that happens if the food is sitting there rotting and decaying. So literally, gastroesophageal reflux disease and heartburn is the wrong kind of acid. It's creating inorganic acid, and we need to make sure that you can break your food down faster. Now, when you do that, the opening at the bottom of the stomach, it opens up, the food drops down in the GI system, and you're a lot healthier. Number 4, the flip side. If you take an enzyme or apple cider vinegar and it makes it worse, which happens about 20% of the time, it means that there's an overstimulation of the vagus nerve, which is a cranial nerve that comes out of the brain and controls the GI system, and you can actually have a condition called hyperchlorhydria, which means you're generating too much acid. But don't worry, the magic mineral helps to downregulate that, and it's called phosphorus. It's really helpful in people that are producing too much acid. Too much acid happens about 20% of the time, and so if you take that mineral, it really helps to reduce hyperacidity. Now the last one, number 5, the stomach protector. You can use a really neat product that basically has your water-soluble vitamins in it. It has montmorillonite clay or bentonite clay, and it's what happens when you take vitamins A, D, E, and K. And what it does is it helps to heal and soothe the irritated GI tissue. It acts literally like a lint roller or a vacuum cleaner for your GI system. And I really like slippery elm and okra because it acts to help pull stuff out of the crevices of the lower GI system and helps to get you regular. And sometimes you need a little bit of magnesium, or you can even use vitamin C to open everything up. So in this different types of products, you want to make sure fat-soluble vitamins, A, E, D, and K for helping GI disorders. And if it's a bacterial problem, you want to make sure that you're taking probiotics. To summarize, number 1, avoid plastic foods. Number 2, chew a lot, sometimes even as much as 25 times. Number 3, speed up digestion with apple cider vinegar or a digestive enzyme. Number 4, protect the stomach with fat-soluble vitamins. And number 5, don't forget about the magic mineral, phosphorus. This is Dr. West, and I'll see you on the next video.